Testing, testing. Can everybody hear me okay? Okay. Thank you guys for coming out today. This is, a lot of you have been to the other two. This is the final part of our series that we wanted to do, starting with lower body and balance, and we did back and core. And so today we're going to talk a little bit about the upper body and why it would be important to keep our upper body strong and flexible. So just a few did you knows. Studies show that sarcopenia, which last time we talked about was just age-related muscle loss. Sarcopenia is more pronounced in the lower body than the upper body. So this makes it even more important for us to strengthen our upper body, because we know, by that being said, that the lower body is going to be quicker to deteriorate than the upper body. So we want to keep that upper body strong so we can compensate for what the lower body isn't doing. Strengthening all areas of the upper body may help avoid compensating for weaker areas. Compensation sometimes affects alternate areas adversely, though. So, and what I mean by that when I say that is, so we get a little pain in this shoulder muscle here. So we might start compensating by using our traps up here. Well, before long, you may notice that now we got a pain in the traps as well. So that compensation can sometimes not be a good thing. So it's good to strengthen overall all of our muscles. Studies show you may lose up to 6 degrees per decade of shoulder abduction starting at age 55. So that would be going out, which we use quite a bit in everyday life, even when we don't realize it. When mobility decreases, quality of life decreases, ability to remain independent decreases, and risk of disability, hospitalization, and disease increases. A regular stretching routine aids in keeping your joints mobile, and then a resistive exercise helps prevent muscle loss and improve bone density. So just a look at the upper body musculature. So you have your deltoids, you have your trapezius, which is more what you think of your neck muscles. They go down into the shoulder. Your pecs, your biceps, and your triceps in the upper arm, and then you have your smaller, on this bottom picture, more internal muscles. This is the lower arm and the hands. And those muscles are the muscles that help you with supination and pronation, flexion and extension, and that's in the wrist as well as in your fingers. So these muscles work together to allow functional skills like these, writing. And I chose these because sometimes, well, actually more times than not, when we see folks, these are some of the things that we always hear about people wanting to do, but they have trouble doing as they age. So that's kind of why I chose what I chose here. But writing, dressing, that includes buttons, zipping, tying, bathing and grooming, hobbies such as puzzles, cross-stitch, knitting, all the things that require fine motor with our hands, sports like golf, putt-putt, volleyball, cooking, laundry, grocery shopping, reaching for items, and transporting items. So these are some functional tasks that also involve the upper body, but that often we don't think about as we're going throughout our day-to-day life. Getting up from a chair. When you're in good health, you don't necessarily think about the fact that you might push up from a chair. You just do it. It's just second nature to us. But when you lose the ability to do that, that's when we start to see, oh, I was using my upper body more than I realized. And that's standing from a chair or any low surface, using a walker. Often it requires as much upper body as lower body, if not more in some cases. So if you've ever been to therapy, or used a walker, a lot of times you'll hear us try to get people not to use as much of their upper body on a walker. And that's true in normal cases, but in some cases when you can't put weight, say you fractured a hip or for some reason you can't put your weight on your leg, you are going to be mostly dependent on your upper body. So that would be a reason that we don't go with our norm. Getting out of bed, in and out of the car, and then sleeping. That's one that we don't often think about, but a lot of times when people have shoulder or arm injuries, it's not comfortable to sleep in a bed. So they end up sleeping in a chair or finding alternate ways of sleeping. Somebody said yes, so they've experienced that. So why is it important to focus on upper body strength and mobility? To decrease risk of injury as we age, to maintain our independence in ADLs and IADLs. ADLs being bathing, dressing, things we do every day. IADLs being grocery shopping, writing checks, things like that we also do on a fairly consistent basis. Maintain mobility that allows tasks like reaching and lifting. Maintain good posture. Decrease rounded shoulders and back. That's all part of upper body strength. And then increase chance of recovery if an injury or new diagnosis does take place. So these are some common upper body injuries or disease processes that we see as people age. Carpal tunnel syndrome is the pressure on the median nerve here. Typically from repetitive movements, can be from other causes, but most of the time you're going to see that from a repetitive movement. Nerve entrapment, and that's when tissues, bones, muscle, anything is pressing on a nerve. Tendinitis is, of course, inflammation of the tendons. Fractures, a lot of times this happens from falls. Oftentimes, because you're trying to break a fall, you reach out and end up with wrist fractures, sometimes shoulder fractures. Adhesive capsulitis, that's a common thing as we age. That's where it's frozen shoulder. In essence, you have stiff and painful joint, limiting your movement. Rotator cuff injuries, and that's injuries to the muscles surrounding the joint, typically from trauma or overuse. We've had a few folks here that have come to therapy for rotator cuff injuries, arthritis and osteoarthritis. And then Parkinson's disease often affects our upper extremities because it causes tremors. So we want to avoid all of these if at all possible. However, several of these do come from overuse and repetitive motions, which typically start early on in life. It's our jobs, the things that we do on an everyday basis that don't bother us in that moment, but later on in life, they may show up. A lot of times carpal tunnel, that's how it works. You might not see that necessarily while you're working or while that's going on. Sometimes you do, but it'll show up later on in life. So, of course, the stronger and more mobile you are, the greater your chance of recovery from these injuries or disease processes. So what can Scotia offer to help me focus on upper body? So you have your classes with Sarah. You have one-on-one sessions with Sarah. You have occupational and physical therapies, one-on-one basis right here at Scotia. Pool activities, and swimming is a great upper body exercise. And then, of course, your exercise in the pool, resistive to water. You have your sports like the putt-putt, the volleyball is big around here. And then bocce. And then for fine motor, your like puzzle, the team that puts together the puzzles, that's really good for fine motor. You have bridge. I think some folks like to play mahjong. Any of those things that are making you use your hands or working your fine motor. So classes that may benefit you here at Scotia. So morning stretches, gentle stretch, both of those are going to focus on your flexibility. Tai Chi has a focus on gentle stretching. And again, that's pool or on land. Drum fit, that's a fun one that you do to music, but you're using your upper body a lot for that. Water aerobics, like I said, in the pool, you're strengthening against resistance of the water. And then let's get physical and morning fitness, and both of those for strengthening. I did note down here, just like we kind of talked about last time, if you do not care for the classes and you'd rather have one-on-one, we can get you one-on-one with Sarah. Or if you have a need for therapy, of course, we can see you one-on-one there. So when might I need to see therapy? If you are experiencing any of the following, this could be, there's a good chance you could need to see some therapy services. And a lot of times when you go to a doctor for these things, that's the first thing they're going to do is send you to therapy, because they want you to try therapy before they do any further testing and things like that. So painful upper extremities, that could be coming from a number of reasons. A lot of times, well, I'll get to that, decreased mobility, numbness and tingling. And so a lot of times that numbness and tingling is what sends people to the doctor, because you start that, it might not be as much pain, but you start not being able to feel your fingers, or something's, you got a twinge in your arm, and that's what sends you to the doctor. Difficulty with ADLs, so that's you're having more trouble grooming, you're having more trouble bathing. It could be that you're having trouble doing the things that you like, those IADLs, like grocery shopping or writing your checks, things like that. Writing, if you're one that writes cards to people, you notice your handwriting's changing and it's not as easy for you. Difficulty participating in hobbies that you once enjoyed because of upper extremity discomfort. So together, our goal is to combine your therapy and wellness experience for a routine that works for you. If you have a need to see therapy, our goal, of course, is to help you reach your goals and then leave you with a plan to follow up. So not just come to therapy and never do anything again. You're going to want to have a plan following that. And it can be, you have a routine and you go see Sarah, you join her classes. It could be that you do a one-on-one routine and we give you a printout of or a handout of independent exercises. There's a number of ways we could go with that. And then, of course, likewise, if you're already involved in a program with Sarah and she sees something or you notice something, it's okay to talk to Sarah about it, and she can get you in connection with us so that we can help you out. So this is a sample of one of our exercise programs. I threw just some of our exercises on there, and we use a program that when you come to see us and say we give you this and this is your independent exercise program, when we print this out, there's a code that you can scan with your phone. And it'll give you, it's got words on it already, so it's going to explain to you how to do these exercises. But there's also a code that you scan, and it's going to show you videos of these exercises. So if you had questions about how to do them, you'd be able to look at that video and see that. This is just some of our equipment here in the gym. And I wanted to make sure I got this in here. So this chart, so any of you that have been in the gym and have used this piece of equipment, there's 40 exercises right there for upper body on that chart. So don't be afraid to get in there and utilize this equipment that's already here. If you are, come see Sarah. We can help you with that. These are a few of my resources. And that's going to end us. Does anybody have questions? Okay. There's a very good possibility. Now, of course, we would have to see you on a case-by-case basis. So we would have to see you in therapy to be able to go through all of that with you. But there's a good possibility that there's things that we could do to help you with that. Absolutely. Anybody else?
Amanda,
Yes, ma'am.
if the doctor sends you to therapy, be sure to tell them to have it for Scotia, not
Uh,
a hospital.
Yes, that's true. If you want to see us here at Scotia, which, we're here, we can see you down in the gym or we can see you in your own environment. So that's the benefit of having therapy here at Scotia, but that's true. A lot of times, the doctors, if they don't realize that, they will automatically send you right to the hospital. So if you want to have your therapy here, make sure to mention that to them when you get your order, that you'd like to have it sent to Scotia.
I know that as we age and we have these ailments and difficulty with our ranges of motion and everything, we begin to mark off things in our life that we can just no longer do anymore and just say, well, that's it, that is what it is, and that's just my life. It doesn't have to be. So having the mindset of not being able to improve, you're not going to improve. Will you be like you were in your 30s, 40s, and 50s? Maybe not. But the impingement that you're feeling, or the ailments that you're feeling, or the range of motion loss that you're feeling, they can be improved, but you have to be proactive. So we can have all these lunch and learns and we can give you all this information, but you're going to have to be proactive and do something about it. I wish we could lay hands on you and that will be it. But unfortunately, we got to put a little bit of effort behind it too. So if you are really concerned, or if there is something that you haven't been able to do that you really want to get back into doing, it could be a possibility that you could. I'm not saying now injuries and things, there are places for needing more intrusive ways to make things better, but more times than not, simple, consistent stretching, consistent mobility, consistent movement can heal a lot of ailments that you're feeling right now. And again, that's like Amanda mentioned, case by case basis, but it does not have to be the end all be all if you're feeling pain.
Thank you. That was good. That's good information because that's very true. A lot of times as we age, I think we just, when we start having these things go on, we just take it and that's just how it is from now on, but it really doesn't have to be. Even if we don't, even if you're not back to when you were 30 years old, for you to have some quality of life and to be able to enjoy the things that you want to enjoy, that's what's important. And if we need to find ways to, different ways to help around that, it might not be exactly how you used to do it, but if we can find ways to help you do it in some capacity, that's what we want to do. Mm-hmm. Well, that's great. That's really good to hear that. Really good. Anybody? Yes, sir.
I'd just like to remind everybody, we got 4 Tai Chi or Qi Kong classes that are taught every Monday, Wednesday, Thursday, and Friday at 10 o'clock. It is all gentle stretching. There is virtually no, but there's no martial arts. It's all slow stretching, and especially my classes are geriatric Tai Chi and Qi Kong, geared entirely to people our age.
Right,
And
right.
we need to, we will work on whatever the class has. My classes are not set as far as we can do the same thing every time. We do what you need to do. Monday's a shoulder day.
Oh, very good. There you go. And that's good. That's a gentle start to stretching. So it's not a rigorous routine. It's somewhere to start in that way. And Mr. Robley, too, can probably help you. If you're having issues, one of us can help you figure out how to work around it. For any exercise, just because you can't do it entirely like they're doing it doesn't mean you can't do it at all.
And that's one of the things I tell everybody. Don't try to do everything I do.
That's right.
Try to kind of imitate it and do what you can do. Go as far as you can go, but don't push it beyond it.
Right.
Any pain needs no gain.
With that, within your limits is where you want to be. Within your limits. Anybody else? Okay, so for the second part of this, Sarah and I, our what we imagined doing was bringing her balance in here and putting it up here on the screen and having you guys ask questions and all that. Unfortunately, we couldn't get it out of the room. Sarah talked to IT yesterday, and it just the way it's set up, we can't get it out of the room. So we're going to open up the floor and just kind of let everybody, if like we can talk amongst each other. If you have certain questions that you want us to answer, if you want us to go down to the gym and look at the machine with you, whatever you need, we want to open up the floor now to answer questions for you. So if anybody wants to go first, I know the last time we had an in-service, I had some ladies that had some input. So, and I do understand from Sarah that you guys there's a few groups now, which I think is a great thing. So you're going as a group, able to give each other feedback. I really like that idea, but.
So I know there was a big push back in the fall about, doing your assessments. It's still not too late if there's something that you are really interested in. We've gotten some really good feedback on those that are using it on a regular basis. And a regular basis just means a few times a week for 5 to 10 minutes is kind of what I've been pushing. Residents saying that they feel more in control of their balance. I've noticed some people who have been coming to my general stretching class and also been supplementing with the balance machine, and they look more balanced and they look more secure in just their movements and more confident in their movements. So if you are interested in, if not, maybe not by yourself, if you'd like to come in a group of a partner or a group of 3, I'd be happy to work that out with you. Just get with me about a schedule. We don't have a sign-up sheet anymore just because of the amount of people have kind of dwindled down from signing up, because we've gotten about, I want to say 60 to 65 independent residents who've gone through an assessment. So I'm really excited about that. But we'll be doing an annual assessment in the fall. So if you'd like to go ahead and get assessed for that, that'd be great. Yes. Yes, so you asked if the machine is always on, and it is. Now, there may be a case where somebody wasn't quite sure of how to exit out of something and has completely exited it out. The computer itself is always on, but I'd be happy to show you if it does happen to exit all the way out, how it can very easily, by a push of a button, pull it back up. There's no signing in. It's super user-friendly. Step on the platform and get going. You don't have to take your shoes off like we did for the assessment. But good question. Thank you.
Anybody else? Anybody want to ask questions? Want to give feedback? So how many in here are using the balance machine? Just by show of hands. And the ones that are using it, any issues, any concerns, anything that you feel like could be easier, we could help you with? So everything's good?
I was just gonna say, somebody else and I are gonna go meet with Sarah. I
Okay.
think sometimes if you don't know, you feel uncomfortable about the machine, just find Sarah.
Just find Sarah.
I mean, that's what she's here for. That's right. But really, I think a few people are hesitant like I was.
Uh-huh.
Because you get there and, yeah, there are a couple little things you do, but you need help.
Yeah. Well, it sounds like people are using it and not as much lack thereof as before, and that's only been a couple months, so that's a good sign. I feel like that must mean that people are getting a little more comfortable with it. So I think that's a good sign. But just know that we are here. If you do have questions, if you want help with it, we can help you with it. Okay. Well, we will end the show unless somebody else has questions. Thank you guys for coming.